let's move on to low-dose naltrexone. I know you're excited about this product. Can you tell the listeners a little bit about LDN?
LDN is a fascinating product. LDN stands for low-dose naltrexone. LDN is an opiate receptor blocker, and it works at this receptor in your body. It's not a new drug, but when it's used off-label at very low doses, it's been shown in many trials to have some therapeutic benefits across a number of different therapies. The 50 milligram dose of naltrexone was originally approved by the FDA in 1984 to treat opioid and alcohol addiction, but we're finding other uses now for it.
So tell us a little bit more about it.
So there's a number of...
What conditions?
Okay, so there's a number of different conditions that can be treated with it. Interestingly enough, back in 1985, Dr. Bernard Bahari was a New York physician, and he discovered purely by accident, for some reason, that much smaller doses, between 0.5 milligram and 9 milligrams, could treat patients and modulate the immune system and provide relief to those suffering from autoimmune diseases. Today, we use this particular medication to help as an adjunctive therapy to treat conditions like fibromyalgia, Crohn's disease, irritable bowel syndrome, Lyme disease, multiple sclerosis, and psoriasis, just to name a few.
So how does it work?
So LDN works a couple of ways. We believe the mechanism works. It blocks opioid receptors, and that has been shown to upregulate endorphin production. And endorphins actually interact with the opiate receptors in the brain to help reduce the pain perception, similar to the way morphine and codeine do. And when endorphin levels are high, we feel less pain and fewer negative side effects of stress and pain. It also affects a component of the immune system, and it's called a toll-like receptor. And it's believed that this effect on the immune system helps to cause an anti-inflammatory or immune dampening effect.
So we were talking about LDN before we went to the break. Why haven't we heard of this before?
Well, that's a good question. LDN is low-dose naltrexone for those just joining us, and it's a product that's been found to help with patients that have different autoimmune disorder conditions that they have trouble treating. You know, it's kind of interesting. You know, a lot of things happen in medicine purely by accident. Sometimes drugs are developed for a specific goal, and they end up having an effect that they find out has other effects that are totally different. You know, believe it or not, one of the best examples of that is the drug Viagra. That drug was originally designed for a totally different reason, and they found that a side effect was it helped with men with erectile dysfunction. So as far as low-dose naltrexone goes, you know, naltrexone was designed to help with alcohol abuse at a really high dose of 50 milligrams or more per day. But for some reason, Dr. Bernard Bahari decided to use really low doses of between 0.5 and 9 milligrams in patients originally that had HIV infections back in the 80s. And patients that had 90 days to live were living over 3 years because they found that they were having benefits to the immune system that helped modulate different side effects that were causing it to fail. So the thinking is that because the patent's been expired for years, no big drug company is willing to do a big study and a big marketing campaign for it because they're not going to be able to patent it again because it's already exceeded its patent life. But the really fascinating thing is there are a lot of individual researchers who are finding benefits in their patient populations, and in the past 4.5, 5 years, there's been a huge increase in studies that have been done by practitioners, and there's over 1,200 studies that have been published recently. So. And it's not small organizations either. Big renowned organizations like Harvard, Stanford, Dartmouth, Mass General. There's some really heavy hitter people doing some research on this particular medication to see if it can help people and benefit their conditions that have been troubling them for years.
So what about side effects?
Side effects is a great question. One of the most side effects for the naltrexone is sleep disturbances and vivid dreams. Sometimes you can have some nausea too. Generally, these these particular problems resolve in the first couple days of treatment. I kind of ironically had a patient tell me once when I was reviewing the side effects with him, he said, well, my dreams have been pretty boring lately. I'm looking forward to having some vivid dreams for a couple days. So, it kind of depends on your way of looking at things. But I would encourage that if someone listening is struggling with something like fibromyalgia or chronic fatigue or rheumatoid arthritis or any of these conditions that are autoimmune related, that you can get some more information about it. It might be worth looking into because the side effect profile really is minimal.
About prescription, do we need one?
Great question. It is a prescription medication. So you would need to work with your provider. We could help you work with your provider to help educate them and educate yourself on what might be appropriate for you. One of the interesting things about low-dose naltrexone is it's not a one-size-fits-all dose. Currently, we're working with about 23 different doses and protocols to help treat patients across a wide variety of autoimmune diseases. So you do need a prescription. And you do need a compounding pharmacy because the custom dose that you need to use is going to be prepared by us in a capsule generally. We can do liquids also, but generally you're going to have a titration schedule that's going to go across 4 to 6 weeks until you find your optimal dose.
So I would suspect that our listeners could learn more about this on the internet or about from our pharmacists. What do you think?
They could. There's actually some very good resources on the internet. One of them, actually, there's a couple different things. One of them is the LDN Research Trust, and the LDN Research Trust was founded by Linda Elsgood, and she has put out this particular book, the LDN book, which has excellent information. You can get it at the Medicine Center Pharmacy at a discounted rate. We're also going to have a seminar in September and October and November, the first Thursday of the month at 6:30 p.m. at the Hampton Inn in New Philadelphia. It's right off 77, so it's a couple hundred yards off the freeway, so it's a real quick trip. But we're going to review the information and the research that's out there about LDN and the possible benefits that you can have, that you might be able to have if you've been having trouble with some of these autoimmune diseases. And there's a variety of medical conditions out there. Like I mentioned, there's been 1,200 research studies done across all kinds of different things, from ALS to Lou Gehrig's to arthritis to psoriasis to multiple sclerosis. So come join us. It's a free event. We'll talk for about an hour and answer questions afterwards. And I think it's something you could get a lot out of. So we welcome you to join us.
So we're going to have food?
We might have some coffee and cookies or something, but come with dinner in you so that we have time to talk.